Good evening, everyone, and welcome to our webinar. My name is Nawara Farhan, and I'm the Corporate Quality Director at Dr. Sulaiman Al Habib Medical Group. I will be moderating this session tonight. With me here today for our special session here is a very special guest, who's Dr. Abdulaziz Sulaiman Al Hamoud, who's a CEO advisor, a co-founder, and a former chief medical officer for Sahha Virtual Hospital. Sahha Virtual Hospital is a state-of-the-art entity created by the Saudi Ministry of Health. It is one of the largest in the region and the first of its kind in the Middle East. Dr. Al Hamoud holds an American board for medical informatics and emergency medicine. He is here today to share his knowledge and expertise with all of us. And he has an extensive experience in digital health, even before joining Sahha Virtual Hospital, which has been an integral part and an icon in the healthcare system in Saudi Arabia. So join me in welcoming our speaker here, Dr. Abdulaziz Al Hamoud. But before we move on, just a little bit of a housekeeping point. Kindly ensure that all of your questions are put in under the Q&A icon. So our speaker will answer them at the end of the session. And now let's move on to our session. Welcome Dr. Abdulaziz Al Hamoud to deliver this presentation for this amazing and important and timely subject. Welcome Dr. Abdulaziz. تفضل.
Thank you, Ms. Nawara. It's an honor to be presented by you, and I'd like to thank the Saudi Center for Patient Safety for this invitation. We're looking forward to get the most out of this 1 hour. Just stay tuned with us and feel free to put the questions that you have on the Q&A, and we'll get to them. Again, I'm really happy to be here. It's a Monday. A work day. I'm sure majority of you guys have been at work, busy or taking care of patients or monitoring the work that's been done by your colleagues. And I promise to get the most out of your time. And let's dive in. So in the next few minutes, we'll talk about the Sahha Virtual Hospital as a use case and try to link it to the important concept of patient safety, how we're really obligated to take care of our patients. When people ask me what's the virtual hospital, what do you actually do, I quickly say it's basically a new dimension of healthcare, beyond border, beyond imagination, with seamless possibilities. And always to see with your eyes will give you more than a description. And I like to start my talk by this brief video. Please.
You don't need to shift the patient from a place where you don't have cardiac service. Yes. You can do a CT scan, and we can access it here in our virtual hospital.
الله عبد المجيد.
الشيخ ظاهر.
الحمد لله.
تخيل 7 سنوات وهو يعاني من مرض ويتحسن في الحبس.
كلام الأطباء أني تعديت مرحلة الخطر.
الاستشاري وتم الدخول على منصة الطب الافتراضي والتواصل مع الاستشاري وأخذ الفحص كامل والتاريخ المرضي للمريضة. تم الاطلاع على أشعة المريضة عن بعد وتحليل الأشعة ورؤيتها للمريضة في حالة سكتة دماغية حادة تستدعي تدخل، وتم اتخاذ القرار بإعطاء المريض العلاج اللازم. كان الوقت اللي تم إعطاء العلاج فيها كان وقت قصير، وصلنا ولله الحمد إلى معدل 25 دقيقة من دخول المريض حتى أخذ العلاج المناسب.
الحمد لله الحمد لله يا رب.
Perfect. So before we get into the nitty-gritty details of the virtual hospital, I wanted to share with you a couple of patient safety considerations that are linked to digital health and virtual innovations. Just keep it in mind, maybe we'll try to test everything that we do across these elements and others. Why do we actually have such an innovative idea? Why do we push into transformation? The reason is clear for a lot of people, which is the current challenges that are we face as healthcare system, the challenges that keep getting even bigger and bigger. Prevalence of diseases, we all saw what happened when COVID hits. Nobody was ready for that. Geographic barrier today, more than almost half the world population, more than 2.2 billion human beings, they live without access to clean water, let alone appropriate healthcare services. A workforce gap, just to put this into a context, we expect to have more than 15 million healthcare worker gap by the mid-2030s, and this is across the globe. The cost of healthcare is rising, and the inequality, the health inequity challenge is also there. We have challenge when it comes to getting access to care, in addition to the clear challenge of digital divide and the need for national health risk management and mitigation. So why we in Saudi decided to take this route and build a unique model, a one-of-a-kind virtual central hub that has all the capabilities that you're going to see. The reality is we're lucky to be in this situation during this era where Saudi today is ranked #1 of the G20 countries when it comes to one of the most developed countries in digital competitiveness, in addition to the increasing ranking in digital infrastructure, technology application development, technical development and financing, in addition to the speed of portable internet and other elements of infrastructure readiness. This put a lot of pressure on us as healthcare leaders to get the most out of such infrastructure. Really to bring to our patients what do they deserve from such a non-stop and effort, a magical effort by the government to try to take the infrastructure to the next level. In addition to that, we didn't really struggle to figure out, to find out what to do with such a robust infrastructure. We have a clear vision that has a very laser-focused strategic objective that we were able to align our capability with. We wanted to facilitate access to healthcare services. We wanted to improve quality and efficiency, also to promote the prevention of health risk. And currently, we live in a beautiful period where if you want to transform healthcare, you have everything that you need. You have the right people, the right mindsets, the right setup, the organizations that believes in transformation, the flexible and really future-thinking regulators, and enough resources to take this to the next level. So always we look at the chain of success and the change of implementing. It always focus on people, technology, and processes. But what's happening in Saudi today is that we have the right strategy and the right regulation to take this to the next level. And we did take this to the next level, and we did achieve. And this is a quick slide just for my colleagues who work in the healthcare design and transformation to really take them through the process of taking digital health to the next level. How did we, what kind of methodology did we take? We basically go through a knowledge collection, a data collection, a way to design a case study, and then link it to national committees, regulatory evaluation, technical evaluation, training, and change management and engagement with people, followed by a confirmation phase and the diffusion of such initiatives. And we're very informed of how do we do healthcare. Healthcare has been around for centuries, and Saudi's been, the investment in healthcare in Saudi has been there for quite long. We see a lot of leading organizations in the region today in Saudi. But for us to take the most out of that, we needed to be aware of the technology trends, what's happening in healthcare when it comes to technology. And in this circle of technology trends, I like to highlight how do you get the most out of telecommunication, telemedicine, video conferencing, engaging with your patients, whether at home or in the clinics or in the ICU, recovery, or even in the OR. The leveraging artificial intelligence and big data is core when it comes to healthcare. Let me just put this into a context. Today, we believe that 30% of the world data is related to healthcare. And for us to get the most out of that, we have to invest in analytics and artificial intelligence. Internet of Things and the application of that in a remote patient monitoring setup is a reality today here at the virtual hospital and in other hospitals across the region. Having said that, we have to be aware of the cybersecurity and the technologies that comes with it. From an advantage point of view, such as blockchain usage, in addition to the risk that comes with it. Universal integration and universal language of communication between different devices, different technologies, and different healthcare systems is really a technology trend that we want to take the most out of it. Robotics and cloud computing is also on the list. Now, we're going to take a brief moment to speak about the setup at the virtual hospital today. But before I go into these 5 elements of care delivery that we implemented and have now experience with it across multiple sectors, I wanted to give you a brief background into maybe a historical elements of what we do here at the virtual hospital. So the concept, the idea, the project started sometime at the end of 2020 with a vision to get the most out of technology and build the best possible virtual care system. Fast forward 9 months into that, where we had to evaluate the feasibility, the technical challenges, the potentials, the threats, the opportunities, and the powerful aspects that we have in the region. After 9 months, we were able to come up with a couple of soft products that were tested across the regulation, that were tested with patient safety, that were tested with governance, RACI matrix, continuity plans, name it. And then within another 9 months, so now if you're counting, that's 18 months, we were able to go for the major launch. That was in February 2022. By that time, we had a robust, mature service for allied healthcare services, including radiology, multiple multidisciplinary committees for advanced and complex cases, in addition to an emergency and critical care hub that covers stroke, adult, pediatric, neonatal ICU. Also, a massive outpatient virtual specialized clinic with a handful of specialties. And we innovated in the way we deliver care at home, and we tried to take it to the next future level. This is just a brief look at what the current services that we have at the virtual hospital, and the list is keep expanding. We started with two services, and now we're at almost 52 different subspecialties, ranging from cardiology, endocrinology, nephrology, and name it. And each one of those goes across multiple elements of care, whether it's at outpatient, inpatient, critical care, or at home. And but before we go into the deep dive, I always want to highlight this piece of document that was written in 1927, and really try to hold everybody's horse when it comes to telemedicine, where Dr. Gale in 1927 wrote this piece, and I want you to take some time to look at it and then try to imagine what we've done so far. So Gale said, if we have telephotography, that was in 1927, why can't we have telemedicine? And again, that was in 1927. But look how he described the telemedicine there, and how our understanding of telemedicine today, and try to be informed when it comes to the future trend and the endless possibilities of telemedicine in the future. Gale says, why can't we have telemedicine so that we could walk up to the radio machine, drop your dollar in the slot, and take down the particular receiver required and apply it to that part of your anatomy where the pain is? Then it says, doctors, please snicker. I would like from the others on these matters and to be corrected where it is necessary to do so. And this is almost 100 years ago. It was an imagination at that time. It is reality today. But I'm sure years from now, people will look at us and say they were dreaming and we made their dream come true. I'm going to give you a couple of deep dives into what we do. And again, I want you to focus on the elements of patient safety that we are going to discuss and evaluate across what we do today. One of the clear models that we always try to share it with our colleagues in seminars, meetings, is our virtual stroke team. So Saudi, or let's say globally, the benchmark when it comes to having access to stroke physicians in a timely fashion within the golden period is less than 3% globally. And that means we're missing out in 97% of the cases. And we wanted to take this to the next level. And we looked at the successful stories across the globe, and we noticed that this can be done. But this initiative, like all telemedicine initiative, is a people-centric activities where technology is just a small part of it. So we launched that virtual stroke team today that is active on 43 different hospitals in Saudi, and that is considered the largest stroke network in the globe, with 43 different emergency centers simultaneously linked to one group, where we could almost instantly have access to the CT scan, process the image, leveraging artificial intelligence solutions, and link with the best possible telecommunication tool that allow our neurology colleagues to evaluate their patient remotely and make the decision to intervene on a timely fashion. That allow us to reach to below 30-minute average of door to needle when it comes to stroke cases. And this is slightly better than the global benchmark. We're really glad of that. But how did we do that? And how, as a patient safety officers or enthusiasts, will look at it? If you look at the screen, it has training, optimization, implementation team, technical support, training. It's all about training. It's all about engaging. And despite the fact that this is a technically empowered team, it is still a human. And to err as a human, and to understand that gap is key. And to look at the patient safety risk and then apply it into that is what really is expected from you. So the team that we're lucky to have today conduct multiple training, multiple drills, and have a really robust backup systems, where we, in some conditions, when we have more than one code or one stroke code at the same time across these 43 hospitals, You don't even notice. The backup team get activated simultaneously without disruption. And this is the key. When you build a massive network where you can't really control the load, to put yourself in the shoes of every critical piece and understand the risk that comes with it. Because healthcare is not forgiven. If you snooze, the impact is related to patient safety right away. The balance will show it. I'm going to go to the next model, but hopefully we kind of understood the theme that we wanted to go with during this brief lecture. So in radiology, teleradiology as an example has been around since also quite long. But when we wanted to take it to the next level, we looked at radiology as a journey rather than a transactional event in the patient care. And we wanted to augment the decisions throughout the whole cycle, from the request itself. How do you design it? How do you make sure that doctors are picking the right investigation for their patient, picking the right protocol for their patient, picking the most wise decision? And let me put this into an example. So a lot of times we'll have a very common example is, for example, the CTPE, and how sometimes it's been overused or underutilized. And we wanted to make this available for our colleagues in partner hospitals to really guide them through the decision. And then when it comes to protocol, we were able to hire a team of expertise that would share protocols and made it available for our network of more than 70 hospitals in Saudi. And I give you another example is the remote acquisition. We're lucky to be one of the first hospitals globally to implement the remote acquisition program when it comes to radiology, where our top-notch technologists at the local hub here could guide through the complex and sophisticated radiology images. To give you an example, if you want to do a cardiac MRI, for example, in the northern region, or if you want to do sophisticated testicular advanced imaging. Sometimes all these images that are part of an investigational journey before even reaching diagnosis are being sent to different hospitals, to a limited number of hospitals in Saudi, but we made it available, just leveraging technology. And we applied some concept of mixed reality into that cycle. And clearly our colleagues in patient safety need to be aware of such technology and the risk that comes with it. How did we mitigate it? What did we do? And the key that I keep repeating it to my colleagues, and it seems to me it's part of our secret sauce, is always closed loop communication, closed loop communication, closed loop communication, especially when the two partners are not in the same location, are not in the same, they don't have the same sometimes thrill that they see. And then if you look at the next level for reporting, today, and again, we want to be very informed of the regulatory constraints that we have. And we work very closely with our colleagues at the Saudi FDA. But when we first started and we wanted to get the most out of artificial intelligence, before even having Saudi FDA approval for these protocols, we wanted to use them as a prioritization tool, where the artificial intelligence will prioritize the load that we have based on potential findings. And now, as we speak, we have more than 4 different artificial intelligence algorithms up and running at the Virtual Hospital Radiology Hub. And we are working closely with our colleagues from different countries through our sandbox collaboration, through our colleagues, participation from different companies in Saudi, where we are building our own locally crafted and tailored to our patient population here in the middle of Riyadh in Saudi. And this is not something that's luxurious. And there are clear examples how countries have to build their own artificial intelligence algorithms just because they're different, their data are different. And the clear example that we always share it with our colleagues is when you build, for example, a breast mammogram artificial intelligence algorithms to look for lesions. If your algorithm is built in more or less Caucasian patient population, then with the skin thickness and the tissue density that we have, and when it comes to comparison between different races, that will never work. Another element that's not up and running, but we're working closely on achieving, is a post-reporting NLP approach to try to bring a very patient-friendly language to the details of the reports and really engage our patients with the findings that we have on them. Another model that we want to highlight today is our cardiology hub or virtual cardiology hub. And again, when you will notice now, when we go into the cardiology model, how we're trying to get the most out of every technology that we just highlighted and every approach that we pinned our focus on just now. So the cardiology group at the virtual hospital has created, and again, it's really important for us to, when you hear one of these examples, to test it across the patient safety challenges that we have. Maybe the 4 elements that I highlighted earlier, or things that you see, things that you notice, things that keeps you up at night sometimes when you think of patient safety. But we'll go over the cardiology in a bit. So the group that we have was able to get the most out of the cardiac imaging or the cardiac PACS system that the Ministry of Health has created years ago to link every test that is done to our cardiac patients within the group of participant cardiac centers in Saudi, where from a single hub you could see echo, cath report, ECGs, couple of lab tests, and other images, and then take it to the next level with surgical planning. The team that you see sometimes go and evaluate critical decisions, when to open a heart, when to go for maximized medication therapy, when to elect for implanting a new device, as an example. And then we took this and took it to the next level by applying Internet of Things. And today, as we speak, with a couple of our participant cardiac centers, we have a robust Internet of Things empowered remote patient monitoring program for complex cardiac cases. And to take this into the patient safety context. So today you have a complex case, let's say a cardiac case, let's say someone with an ejection fraction of less than 10%, where no medication regimen is able to maintain that patient. No wellness program or dietitian system is able to keep that patient dry. So now when you face similar cases, and this is not a dream case, this is something that our colleagues in emergency medicine or cardiology or internal medicine will see every other day. You will need to do it differently. And our patients now expect that we provide to them the top tier potentials. We'll take it to the next level, right? And now what we do, we implement an advanced home-based monitoring, where if the patient's weight changes every morning, we'll know. Our colleagues in cardiology will change their Lasix dose, as an example. Will prevent deterioration. And this clearly led to limited number of readmission and limited number of complication during the shortened admission period. So before we did a small pilot in a very controlled setup, and we saw a reduction in the length of stay from almost 9 days to 5 days because of the use of advanced tools such as the remote patient monitoring. Now in this slide, I want to go back to the first slide that we showed at the beginning, where we said in healthcare and patient safety and artificial intelligence technologies and other healthcare innovation are linked to multiple patient risks or patient safety risks. And I want to go back to the slide that I first showed you, which is this slide, but added some additions to it. So we always look at diagnostic errors, and we think this is part of healthcare. But today, with technology, we cannot really eliminate it, but we could augment decisions. And I think this is a core in healthcare 2.0, the way we practice today. And to put this in a context, today as we speak, a single ICU patient will generate more than 1,500, between 1,400 to 1,500 data points every day. So, and that includes trends, includes variation, includes details that were not catched before. So when you make the appropriate decision with that, you need to be augmented, you need to be empowered. And we think technology could do that for you. The other piece is medication safety. We always talk about, I remember during the early phases of training in medicine, the medication reconciliation elements of patient care and how complex is that, right? And making sure that you give the right dose, the right medication, and the drug-drug interaction. Today, as we speak, the care planning per se includes more than just medication therapeutics, but is enhanced by digital therapeutics, by elements that takes the patient care to the next level. And indeed, this cannot be done without the use of technology and the training of our fellow healthcare providers to get the most out of the technologies that we have. Another element that I wanted to highlight today, we spoke about how digital health and innovation could help you escalate care pretty quickly in the case of remote patient monitoring conditions, in conditions such as heart failure. But in reality, what we want to say is not just escalation, but also de-escalation. Really making sure that you get the right level of care to the right patients at the right time. Your patient doesn't really need to stop by the clinic every 6 months to get his 6 month worth of day-to-day feelings, symptoms, signs, collection reviewed by someone in 15 minutes. You will be able to make your care appropriate simultaneously and instantly. In the context of equity of care, I want to take this into multiple levels, and you will excuse me for spending a couple of minutes here. So we all wanted to provide fair and equal care to our patient population. And at the virtual hospital, as example, when we started, we found ourselves quickly attracted into targeting special patient population. So we engaged with the neonatal care in building a robust neonatal ICU system. And then we worked closely with our colleagues to build a major geriatric hub and supplemented that with home care participation and looking at how do we provide care differently. And I wish you could sit to one of those monthly sessions where we start calling our patients and ask them about their experience, especially our fellow geriatric patients at home. And if you just listen to what they'd say when it comes to the comfort of getting treated at home, surrounded by their family, you would really be surprised, and that you will be full of excitement to take this to the next level. But when it comes to how digital health is tackling the equity of care, there are multiple things excuse me, to highlight. The first is the digital divide. I know that Generation Z is now very tech savvy, and millennials can do that, but still we have a patient population who are not tech savvy, who they don't have iPhones, and we have patients who doesn't have. Maybe we'll stop for 1 minute. So yeah, so when it comes to the equity of care, the ability today to take it to the next level and not only be inclusive of all different patient populations that you have, but also provide a very tailored and personalized, and I want to say precise care, leveraging technology and other advancement such as pharmacogenomics. And this is in a nutshell. And the reason why we wanted to have this, I mean, the main objective of our talk today is to really make our colleagues who are interested in digital health and patient safety look at it differently. Look out at the things that digital health could bring to patient safety, whether it's a risk and then know how to mitigate it, or an opportunity and powerful addition to our healthcare, and try to implement it within your colleagues. Thank you so much, and looking forward for the questions.
Thank you, Dr. Abdulaziz. What an amazing talk. And I almost feel that we need more of it because this is such an important topic to healthcare of today, for sure, and potentially even healthcare of 100 years ago, based on what I saw. Now I'd like to ask our participants to kindly post their questions in the Q&A under the Q&A icon, and our speaker will gladly answer them. So let's give just a few minutes for our participants, a couple of minutes for our participants to put their questions in. And once they do, we'll just discuss them with our speaker. Okay. So I have the first question. What are the most challenges that you've had in the implementation of the virtual hospital? Which I think probably I honestly have a huge interest in this, because such a big project connecting all of those areas together. I'm really interested to know what are the challenges, and also with whom did you face them, and how did you actually tackle them? Because this is extremely important for implementation of such a big project in such critical times. I think this is extremely important.
Sure. Thank you so much for your question. So the biggest challenges that we faced were related to really change management and bringing our partners with us to the same futuristic ideas. And I noticed that a lot of our colleagues are very conservative when it comes to protecting their patient care. And in order for us to I spent more than 14 years in digital health. So when I try to implement something, I'm comfortable that this is safe. But the way we highlighted, the way we were able to tackle that was by highlighting their concerns early on and address them one by one. And I always try to, when we start having this discussion, share with them Prof. Joanne Ash's article in The Unintended Consequences of Healthcare or for Innovation. And I always tell them that before we take the first step, we try to find 100 reasons why we should not. So if we cover all these elements, if we ensure that we are not introducing a harmful intervention, then we usually gain their trust and take it to the really next step. Because you want people to think out loud. You want them to share with you their concerns out loud, and you will be able to address them. And the other element that I really want you guys to focus on is really never underestimate training, soft launches, engaging, feedback. Yeah.
So change management, really, what I'm hearing from you is that change management elements are extremely essential for such a disruptive innovation. And ensuring that we have all of those components that many sometimes underestimate. The engagement, I think the engagement of our staff and our clients, or basically patients, and our communities in such big projects is an extremely important aspect of things. So I'm interested to know, other than education and other than training, how did you engage the patients themselves?
So when we today we have maybe I highlighted it during our talk, but we do have a monthly meeting or work group where we sit down and we we have a set of representative patient population where we call them and get their constructive feedback.
Very nice. So patient advisory council taken to virtual.
Yeah.
Wow. I mean, I would have to say that this is even a different level in quality and experience. So you have a virtual patient advisory council to go with a virtual hospital,
And the way the beauty of that, usually when you ask your patient about their feedback, while they are in your territory. They are in the hospital. It's different. But if you call them and sit down and listen to them where they are in their living room, it's their area. They speak with more confidence. They highlight elements that sometimes you'll be surprised the pieces that they focus on. For example, the way they, especially with the geriatric patient population, they were able to really speak about the hurdle that comes from transporting their patients, their family members, sometimes for a simple outpatient visit. And they would speak about things that never comes across my mind, at least, how to really leave their job, take a leave from their work, then come home and sometimes try to find helpers to help them move their family members, and then maybe even hire an EMS, an ambulance for transportation. So, and they will be willing to do this if there is a critical intervention or if there is a specific diagnostic elements. But for follow-ups, they really felt thankful for the new approach of providing virtual care at the comfort of their homes.
Very nice, very nice. That's beautiful. I have a comment from Amal Yunus saying, thank you for your effort. Can we see this covered in all hospitals or on all hospitals? I believe the virtual hospitals actually covering the whole kingdom. Am I correct?
So today the network, and this is the beauty of having years long of investment from the ministry and the government. Today, as we speak, the number of hospitals that has rendered care with us to their patient exceeded 170.
Amazing.
Yeah, 170. And that's almost 70% of hospitals above 100 bed in Saudi.
Okay, okay. Yeah. And I'm assuming there is an expansion ongoing. Am I correct?
Yes, we actually, and our colleagues at the WHO, if they're with us in the meeting, know how the virtual hospital setup made it possible for us to work cross-border during disaster response situations, and also during today, as we speak, we have a representation from patients across 5 countries with our multidisciplinary committees, where we discuss cases from other countries too.
You know, I'm so glad you touched on that, because one of the questions I was interested in asking was around the potential for health outreach through such technology. And it seems to me that you have basically some footsteps into that area. Could you please elaborate on your experience on that?
Yeah, definitely. So we work closely with our international partners to build it in multiple arms. The first element is building a virtual global outreach programs. And the beauty of that global outreach programs are there since quite a long time. I remember even during residency, you would have some of your colleagues going into Africa or South America, and within a very structured outreach program. So adding the technology element to it is not complex, as long as you're aware of what you're doing. And this is core. The other elements that we work closely with our colleagues at the UN, WHO, and the UNICEF is building a robust virtual disaster response team, where we engage in the disaster planning, in the engagement, offloading some of the events that happen from the team on the ground. And we have a successful model during the recent earthquake, where we were able to link with a couple of the camps and really support patients there virtually with niche services, having access. I'll give you an example. We were able to provide access to psychiatry and psychology support for PTSD during in the post-disaster aftermath. And without the use of technology, usually this is not the core focus of boots on the ground and EMS interventions on the ground.
Very nice. I think this is extremely impressive. I do have one more question that, any safety professional would want to look into that, which is our hot topic of every day in our daily procedure, which is safety reporting. Safety reporting in the virtual setting. How does that, do you have any specific challenges to that? Given that things are on the virtual plane, we would say, how did you find the engagement in terms of reporting of safety incidents? Is it voluntary? Is it basically automated? How does that work? And what challenges did you face? And what strategies did you take in order to improve or to ensure that there is a safety culture within this virtual hospital?
Yeah, that's a good question. This is actually $1 million question. And when we first wanted to start, we spoke with the leadership and say, hey, we want to do this right. If you cut us slack at the beginning, it's just going to come back at us and bite us. So we spent almost 9 months with a group of very tough evaluators to give us the commissioning assessment. And imagine commissioning a virtual hospital in the middle of COVID. There was nothing like that. It was really a very interesting approach. And
I would imagine.
Yeah, and the beauty of it, the reason why we were able to achieve that, because we believed on fundamental elements that do not cut a slack, do not find loopholes, because this is just going to make you fall apart almost right after the COVID pandemic stops. We wanted to do it right. And in our first evaluation, these are the things that they were highlighted. We want you to promote safety. We want you to ensure that every element is as safe as any traditional hospital. Okay. And in reality, what happened is we started to influence our strategic partners, traditional hospitals where we work with them in ICUs. And we say, hey, how come we want this safety protocol to be implemented? We want your RT in the ICU to follow the following. Our lead charge nurse in the ICU will implement our standards and take these. And luckily in Saudi, the level of care, at least the policies and procedures are in place in a lot of these organizations. But usually if you if you walk together, you reach faster. And we noticed to give you one of these as an example, the extubation, intubation metrics in the ICUs. We were able to track it and report it. And we noticed that the hospitals that work with us has a tremendous improvement. Because when you start moving your care into the digital era, everything becomes very transparent. And
Very nice.
You have to be honest with yourself. How do you do it? And that comes back to your patient as the proper and appropriate care.
Amazing. Really, I think this is amazing. If we walk together, we reach faster. We have one question here from another participant. How much do you think healthcare informatics field influenced this tremendous transformation in the healthcare sector?
Yeah, this is also a great question. So I think technology has been around for quite long. What is unique is, and I'm going to be very honest here, what is unique here is a vision, a strategy. You saw what Dr. Dale said. It's in 1927. It's been there. If I have reports from the 1800s where people has used some format of telemedicine. What is unique is the vision, the strategy, and the technology. Yeah.
Yeah, so technology alone will never be enough. You know, we heard you talk about several things today. Technology alone is not enough. We absolutely need the vision for it. We should not be underestimating the power of change management practices and engagement. And I really love what you said about if we walk together, we reach faster. And in such situation, you are certainly walking with an army behind you, with all of those connected hospitals. I think, and the impact, the beautiful impact also on quality and patient safety in the regional hospitals who are affiliated with you. So such a great influence. I would say congratulations on such a successful icon in healthcare and the Saudi healthcare crown. And on behalf of the Patient Safety Center and the World Health Organization, I'd like to thank you for such an amazing talk in a topic that's extremely, extremely important to healthcare of today and tomorrow, and apparently 100 years ago. And I'd like to thank our audience for attentively joining us for this important topic and really being, the great ambassadors for such important topic in the near future to their hospitals, to their areas as well. And I want to thank the Saudi Patient Safety Center for the efforts to provide us with the timely topics and interesting speakers like yourself. And we really would like for our participants to fill up the questionnaire and the evaluation that's provided to them, that will be provided to them at the end of the session. If we don't learn, we do not improve. And, we always want to make sure that we're doing things right, and nobody cuts us any slack. So please put any improvement opportunities for us. So thank you all for joining us today, and we look forward to welcoming you into the future webinars. And as I spoke and I mentioned to Dr. Abdulaziz, I personally look forward to future, not necessarily webinars, but future sessions, hopefully some in person or virtual, to get from your knowledge and expertise that are extremely valuable to healthcare. So thank you, Dr. Abdulaziz.
Thank you so much, and I appreciate your time and the opportunity. I'm looking forward for future collaboration. Thank you.
Thank you. Thank you. All right. Thank you very much. And we'll give you back just maybe less than 2 minutes.